Hello, it's Dr. Yock. I'm sorry I missed you. Calling with the lab results. So everything looks okay. There's some couple things to talk about. Let's talk about the labs first. Very happy with her labs. She's got a normal red cells and white cells, a normal hemogram. So great. So there's no like massive infection throughout her body or anything like that. Her chemistries, which is her kidneys, her liver, her electrolytes, her digestive enzymes, all of those very normal. I mean, normal for a 3-year-old, not an 8-year-old. So couldn't be happier. Her urine was good. The only thing about her urine was that it had some protein in it. And extra protein loss in the urine is not normal. And that may be a one-time thing, or if it's persistent, that needs to be checked again, and we recommend checking in 1 to 2 months, having a urine sample brought in. And if it's persistent, then we pursue that. Again, we shouldn't have protein in our urine. Her thyroid, interestingly, came back low. Anything below 0.8 is considered to be abnormal. Hers was 0.5, so she's got hypothyroidism. We talked about her being a little bit chunky. Well, the good news is that having a low thyroid is a good reason for that, and it's pretty simple to correct. It is basically taking a thyroid medicine, but you need to find out what dose to give her. And we pick a dose and we say that's what we're going to try her on for 3 weeks, and then we recheck her thyroid again. And if it's in the good range, then we stay on that dose for a year, check it again. If it's not the right dose, we adjust it and recheck it. So I'm going to get you a prescription of thyroid medicines. Her x-rays, of course, we sent it to the radiologist. He agreed that our Dahlia has a bronchointerstitial pattern in the lungs, which is either going to be a chronic bronchitis, a tracheitis, or possibly a laryngitis, but there's no evidence of laryngitis. That's just what he said based on an x-ray. So I'm going to try a different antibiotic for her. It's called doxycycline. You can add that to the one you're giving, and of course you're going to start her on the thyroid. If she dramatically lessens in her cough, then she had a bacterial bronchitis. If she does not, then I want to schedule her for a bronchial brushing, and that's where she has to have a short anesthesia and have a little sampling in her lungs. And we culture for bacteria, for funguses, for the whole 9 yards. And we're trying to get to the heart of the bronchitis, so to speak. So, but in any event, so overall good news. Radiologist agrees with the bronchitis. Going to try some medicines. I want a phone update in a couple of weeks if it's made a difference with the cough. The thyroid, I'll write on your paperwork. In about 3 or 4 weeks, we want to recheck the thyroid again, just the thyroid, and we want to do that 4 to 6 hours after you get your morning pill. And the pills are given in the morning and the evening, and you bring her in for the technicians about 4 hours after a morning pill. And this is 3 or 4 weeks from now, and we see if she's on the right dose. So anyways, if anything there is unclear, it's a lot of information, just call me back, okay? Otherwise, you'll have a couple prescriptions up front. Thanks.